Okay. So good evening, one and all. My name is Vivek Joshi. I'm your host, and today's special guest is Dr. Rahul Sharma from Mumbai, who runs a NGO named Hope, Faith, and Youth. And he has treated like more than 1,500 COVID patients for absolutely free of cost. And a lot of hard work is required to help these many people, that too selflessly. So help me welcome Dr. Rahul Sharma. I can't thank you enough for accepting this invite and taking out the time of busy schedule you are having. So that's really grateful of you.
Thank you so much, Vivek.
My pleasure, sir.
And thank you
And
so much for this creating such kind of an awareness program. I think it will help a lot of people.
yes, definitely, it's helping a lot of people, and you are the testimony for the same. To start off with, what is the difference between the first and second wave of COVID?
Okay. So for understanding first and second wave, first understand what is a virus. So Vivek, virus is a living organism. वो जिंदा एक चीज है, living organism. And just like you learn in class one, something which is very primitive, बहुत basic सीखते हैं you in class one. But as you grow and go in class 3, 4, 5, your intelligence increases, your knowledge of study increases. That is
Yeah.
how virus works. So in the
Yeah.
earlier period, and especially in 2019, 2020, the virus was very new and very in a very primitive shape. Still, the virus had a lot of capacity to infect people's and their respiratory system, their cardiac system, their breathing and their heart. But
Okay.
with the medicine we gave, the medicine we took, the kind of lifestyle we changed, the
Mhm.
constant suppression, the constant pushing that we did with the virus, it
Mhm.
kind of evolves. Every time a virus multiplies, it tries to evolve. And whenever, and in this evolution,
Mhm.
some changes are very dangerous. Some changes weakens the virus, but few changes is make the virus more stronger than it was previously. So in the first strain, Vivek, if you can see in your surrounding, the
Mhm.
people are marginally infected by breathing, but
Mhm.
their
Yeah.
systems were, उनको जो system symptoms थे, there were breathlessness, dry cough, loss of smell. If you can remember that, एक
Yes.
साल पहले symptoms ये था that loss of smell है, a dry cough है, sore throat है. But as the time passed, we gave we means our entire human people, entire
Mhm.
human civilization, we gave a lot of medication to it,
Mhm.
and in few cases the virus mutated to become very weak and died off. But in few cases, like a constant infusion of medication, it
Mhm.
become more and more stronger. And by the time the stronger virus remains in the community, थोड़े दिन भी, imagine 1 or 2 months of period, it kind of become the very easy for this stronger virus to spread very
Mhm.
fast. This is what happened in Brazil, and this is what happened in India. That in the
Okay.
last 1 year, maximum countries were taking too many medications in the name of immunity, too many medication in the name of increasing our strength, increasing our immunity. If you can recall, एक साल से आप ये सब देख रहे हो अपने आसपास न्यूज चैनल्स में, मार्केटिंग में, कि कैसे अपना
Yes.
इम्यूनिटी बढ़ाने के लिए ये लेते रहे. तो कभी
Huh.
पीपल आर टेकिंग HCQS, कभी विटामिन सी, कभी जिंक. एवरीथिंग इज गुड, nothing is
Mhm.
harmful. But this virus fellow is a virus friend of ours, is very intelligent. And whenever you give something to it, it will evolve. So right now the condition of virus is that it will not show dry cough or cough for the first 7 or 8 days.
Okay.
So Vivek was identifying this virus 1 year
Mhm.
ago with simple cough. But right now, cough, loose motions, body ache, fever, everything can be a symptom of this virus. And on the
Mhm.
top of that, Vivek, there are many type means many strains of virus in the market or in the community. So few are getting, so in the second wave, Why it is very
Hmm.
difficult to treat and identify? Why the news channels are saying that even RT-PCR test is not valid, even fever is not valid. You have to believe that if you are infected, if you are having
Hmm.
any
Hmm.
sign of COVID. Okay, but
Okay.
why is this so? Because most of the symptoms that were trustworthy 1 year ago are
Hmm.
completely baseless now, are completely non-indicative because the virus is not showing you the sign for the seventh or eighth day. And
Got it.
by the time virus reacts to you, Vivek, your immunity is already very much weak. This is the difference in second wave, and that is why many people are dying. They are getting infected very fast, but they are not showing any symptom. By the time they show the symptom, they
Hmm.
must have been traveled a lot, met a lot of people,
Hmm.
and become so weak that they will not be able to sustain more. That is why the
Okay.
death rates are so high.
Yeah. Got it. So this is the main reason of why community spread is increasing at a faster rate compared to
Yeah,
the first wave in the second wave.